So thank you very much for joining today, everybody. First, just a little bit of housekeeping for everybody. So your cameras and microphones have been turned off just while we go through the presentation. But if you do have any questions during the session, please pop them into the chat or the Q&A section, and we'll get to them when we come to the Q&A at the end. We are recording the session today, just to let you know. And if you haven't registered for the session directly, so if you joined through a link that somebody else has sent to you, please do make sure that we've got your email address and job title in the chat, just to make sure that you get all of the information after the session today. Today's presenters are myself, Claire from Redmoor Health, and Kavita from Oberoi Consulting, and we'll also be joined by Vivek Patel, Operations Director for Oberoi, for the Q&A at the end. So first of all, this session is brought to you by the D&T Network. So the Digital and Transformation Network came to life in September 2024 with an aim to connect everyone across healthcare that's interested or involved in digital transformation. We've currently got over 1,200 members on there from primary care. So if you're not part of the network yet, you can either scan the QR code that's on the screen, but after today's session, you'll also receive an invite to join, and that is where all the resources from this session will be held, so you'll be able to see all that information there. And today we're going to be looking into QOF and how to maximise the outcomes, as the countdown is on with less than 4 months until year end now. So Kavita is going to take you through why prevalence matters, some high value domains and indicators, some small quick wins for you, about exception coding, optimising clinical workflow, and the all important Oberoi calculator, and then some common pitfalls. And then we'll finish off today with a Q&A section. So if you've got any questions, please do raise your hand then. And I will pass over to Kavita.
Brilliant. I'm just going to share my slide set. Bear with me. So good afternoon, everyone. My name is Kavita Oberoi. I'm founder and managing director of Oberoi Consulting. We've been working with the NHS now for over 25 years. A lot of our work, we have a number of tools that we have developed. Some of those are free of charge. They've been sponsored by pharma. We also have clinical review pharmacists. So for the last probably 25 years, we have been talking a lot about maximising QOF. And this year we launched a fantastic calculator as well, which I'm going to demo to you to sort of help you to sort of get a strategic perspective on delivering QOF. And it's so much more important now in these last 4 months. So let me just move my slide. So as we know, we've just got 4 months to go. So what is it that you can really focus on, or maybe think a little bit differently with? Maybe there's some, there's some high impact quick wins. So if you really start looking at the indicators and the value of the indicators versus the numbers needed to achieve, we can really pull out those high quick wins, and I'll show you how you can do that. I think understanding your data is absolutely key. I suppose in any business, whether it's healthcare, non-healthcare related, that baseline data is the key to moving forward and creating that plan and then that implementation. So again, from today, it's really important that you know exactly where you are, where your gaps are, so that you can go away and you can identify those outstanding actions quickly and easily. So this is an example we ran at a 12,000 population practice, and obviously the income will vary per domain depending on your practice size, your CPI, the ADPF. But what we've done here is just sort of looked at the different high value domains, and you can see in the top quadrant here, you've got vaccine, CHD, cholesterol, hypertension, diabetes. And then as we go down, you can sort of see how these other domains sort of drop down. Obviously, that's a lot of data to take in, and it would be nice if this could be done automatically. And obviously, you've got your high value domains, but also your high value indicators. And we know there's a number of indicators. And when you look closely, some of the indicators, they've got very little monetary value assigned to them. So I suppose at this time of year, when you've only got 4 months to go and potentially limited resource, it's really about focusing in on the high value indicators and the domains, and also looking at your resources and workforce planning. So this again was run in this particular practice, and we can see just in terms of numbers, you know, you can go from 14,000 right down to 361,000 for that indicator there. And prevalence also really matters, because some practices, we're working with some practices currently where actually they've hit all of their domains. I think some of the focus on prevalence has moved away, but that's the next step to maximise your income, because what we're finding is when we're doing coding work for practices, it's not that the practices, these are new patients. They are there, they have been managed, but they just don't have that label in the clinical system. So again, you know, which areas can you perhaps do some coding activity to maximise the value of the QOF point where you've hit a lot of the indicators. So what I'm going to show you, because it feels like it's probably the right time now, some of the data, as I said, we pulled out from our calculator. This is a screenshot from our calculator, but I'm going to show you how this does this work continually. It's very dynamic, and you can do it on a weekly basis. I'm just going to show you this now. Bear with me. Okay. So we've got a number of practices up and down the country who've been using this, finding it very easy to use. So once you have got access and you've logged in, at the top of the QOF calculator, what you will see is literally how many weeks we've got remaining, days we've got remaining, where you are currently, and your income that's still available. So once you get access, if you're a System 1 practice, you will literally download your searches, and you will download those once and put it onto your clinical system. So it's the searches that drive the tool, and we've got practices who run the tool every single week. So you download them once, you run your searches, and you upload the RTF results. So all you're uploading there is numbers, and same for EMIS. And there are instructions in here on how to do this. So once you downloaded your searches, got your search results and uploaded it, then what happens is generates your practice action plan. So what I talked about in the slides previously is your high value indicator. So what this does, it produces your strategic plan. And this is live, so if you run this today, you'd get this live for today. And as we know, it changes on a weekly basis. So we have a lot of practice managers who are running this weekly, and they find it really motivating because they'll download the results from the previous week, create a very clear action plan, who to allocate specific tasks to, work with the recall teams, and they're able to show at the next meetings the impact that it's had. So what we've got here is, if you go down the side, you can see this indicator here for vaccines. At the moment, there are 8 patients for this practice to recall to get to the threshold. There's 11 patients that are not hitting that indicator. But what we can see is the pounds per patient for doing that activity is £813 for every patient. So if we hit the 8 patients, then that will bring in the additional income of £6,500. What we've also done is looked at some arbitrary appointment durations. So what you can do is you can look at your indicator and you can say, well, how long is that actually going to take? What the appointment times, and work out your resourcing and sessions. So again, here for cholesterol, there's still 62 patients. There's 10 hours and 20 minutes if everybody was giving a 10-minute appointment, or 15 or 25. So again, what this has done is, as I presented, the high value indicators can really help you to focus on those indicators. And we can see here, this is the new diagnosis of asthma with a record of an objective test. So there's just one patient there that needs to have that objective test, and the additional income is £152. So this is pulled together in that way. And as we get to the bottom, you can see here the low value indicators. So this can help strategically from looking at, especially these last few months where you're still needing to achieve the indicators, but where really to focus that activity, considering resource as well. So as I was saying, some of you may have already hit X number of indicators, and I'll show you on this tool where we can have a look at that as well. But the next part where you can really make a difference, and even if you haven't hit the indicators, this is an activity very worthwhile doing. Every time, I mean, we've been doing this for years for practices, helping them to understand this. But you can see here, this table here are all the registers in this practice which are under England prevalence. Now, as we know, the prevalence of each indicator affects the value of the QOF point and in turn your income. So for diabetes, the practice prevalence is 7.7, the England prevalence is 7.89. And the additional patients we need to code, not necessarily diagnose, because when we've been doing code cleansing activity, we know that the patients are there. It's just a matter of adding the code to the register. The additional income available per patient will be £26. So that works out around about £500 there. So again, you can think about, well, which resource, which indicators, and you can use, a lot of you probably have your Ardens data quality searches, so you can go into those searches and you could do that activity. Now, the other one, table, this shows you all the registers where the prevalence in your practice is higher than England. And again, as we know, it's uncapped. The income is uncapped. The higher your prevalence, the higher the value of your QOF point. So this one in particular, we've worked in heart failure for 12 years. And we've just run some data across England. If your LVSD prevalence is less than 0.6, and do have a look, you can have a look at your indicators on QOF, you've got a lot of patients there to find, and there's £43 assigned to adding the phenotype, in particular HFrEF, LVSD, to the code. And this is an exercise that is quite easily done. What we're finding is you get letters coming through from the hospitals. They put the echo on there, they put the ejection fraction, but sometimes maybe somebody in admin doesn't understand that clinically, and what they've done is missed that code. So this is a really easy one to pick up this extra income. Recently, we've been doing an exercise for practices where we've been doing the heart failure work through our nurse specialists. And we've delivered thousands. There's a practice where we've increased their income by £5,000 just on the prevalence before we start the optimisation work. So again, this is an area to pay attention to, in particular, if you feel like you've hit some of those domains. But even if you haven't, it's worth looking at these monetary values. But this is an easy one, heart failure due to LVSD and the heart failure, because the coding, we know from experience, is really poor. We're also doing a big project across Hampshire ICB around asthma and chronic COPD. And again, it's quite easy using the code cleansing searches to sort of find patients who are missing these codes. So something to consider. What you'll also find on the calculator is a view of all the domains versus the income achieved. So if you did want to sort of talk to your team separately, the respiratory teams, the coronary CBD teams, you can, and you can see the indicators there. These can be sorted in different formats as well, but that's just another view of the same data. And then as your indicators are hit, they'll all sort of sit down at the bottom. And these are all the indicators in this practice that have been hit. One of the questions maybe is, yes, that this gives us our strategic plan, but how do we find the patients from this plan? So if you wanted to find those 11 patients, you will have downloaded our searches from here. You go back and you find the search V001 relating to this indicator, and that's where you'll find your 11 patients. So I'm just going to stop sharing and going back to the presentation. I don't know if there's any queries just before I go off this screen, because I could answer those. So if you did have anything, you can pop those in the chat. What we found with a lot of practices is now they've coordinated using this data. The recall teams changed how some practices are managing their diabetes recall. They've looked at the end of the year how many gaps they have, looked at how many appointments they're going to need to make sure they hit every week, and using this data to make sure those are being managed, because on here as well you will get you get a very clear indication of how many weeks you have left as well, which you can look at versus resourcing. So if there's anything that you need to put in the chat just around any of these, I can answer that now. Just going to go back. If there's anything in the chat, let's have a look.
There's just one question about the cost.
The cost, yes, the cost of this calculator is £280 plus VAT, which is a very low cost. It's sort of been a launch cost for this year. Claire's going to tell you about an offer we've got on for you guys who are attending this session today, and that's for the end of the QOF year, and it doesn't matter about your practice size. Okay. And a lot of practices, we've had a barrage of practices who have sort of come on board at this time of year, because I suppose this time is one of the most valuable times of the year. So I'm just going to go back to my presentation. Okay, so just to go back, prevalence matters. I know sort of this value isn't high as it used to be years ago, but we used to talk a lot about prevalence, but it's certainly worth looking at. So when you've done your analysis, and again, this sort of info has just been from insight, from practices, so you can have a look at, where's your quick wins, look at those indicators that have been prioritised. Can you use AccuRx for messaging for home BP? Can you, if you've got a surgery pod, can that be used? Might be offering bookable appointments. You might be able to use medical students to assist there. Asthma triage. So we've been doing a project, as I said, across Hampshire ICB, and we created a specific AccuRx questionnaire for patients. And again, you may have still a lot of asthma patients still to review, but again, in terms of the highest risk, could you look at those who have been returned and then manage those based on their ACT scores? And again, some of the indicators, it's more about capturing data. So again, thinking about all the digital tools you have in your systems to be able to capture that BMI, smoking status, and BP readings. Some really quick wins, and it has worked for some of the practices who are at this stage and looking to sort of maximise those numbers with sort of digital tools. Again, looking at informed dissent, patient declined, clinical unsuitability, end of life. Obviously, the searches for the patients who still need to be managed, you can access those through a tool or through your population manager. You'll be able to pick those up. Anything to do with medication type coding, and the non-responder with the 2 invites. And again, a lot of this is about optimizing your clinical workflow. So your different skill sets and your different skill mixes that you have in your practices. So, for example, your HCAs for the data collection, observations, lifestyle, education. Can you utilize medical students? Think about the skill mix and skill sets of your nurses and pharmacists. You know, what are their specialities? For example, with, you know, you might be conducting some inhaler switches. You know, can that be undertaken by the nurses, pharmacists? And then there's titration of blood pressure and lipid treatment. And lipid treatment in particular, you might, you know, need to bring that skill mix together. There's a lot of points this year with the QOF changes in cholesterol management. And again, you might have specialist clinicians, or you may be able to access specialist clinicians for particular complex patients. So we're doing a piece of heart failure specialist nurses are currently doing a specialist piece of work for a number of practices where they've lost the heart failure nurse, or they've got huge numbers of patients. And we've helped them through data searches to pull together those that they need to meet for QOF and the basic ACE and ARBs, but also then go further for complex patients who have got HFrEF, may need the 4 pillars of treatment. And again, for diabetes, you know, the insulins, GLP initiation. So again, you've got your QOF data, but then you can also edit some of the searches further or overlay them with information on what they may be on at the moment to sort of prioritize those, and just thinking about the skill mix and who in your practice has got the capacity to do the different various groups of patients. So obviously we've talked about some quick wins. If you overlay that with the calculator, you will be able to track your weekly progress. It is real-time data as well. And I think every practice that, you know, we tend to do some feedback sessions, they have been able to identify opportunities to maximise prevalence, what they otherwise perhaps may not have looked at. It will help to assist you prioritising the income for the indicators. We have seen some very sophisticated Excel sheets doing something similar, but not as sophisticated. So this takes out the human error and that manual sort of work. And you get a clear overview of the patient's allocation time required, which is particularly important once you get to December, because the end of year has come very quickly. January to March is going to be even faster. So this is the time to really focus and prioritise on those quick wins and maximise that QOF income. Again, just some pitfalls to watch. If you are using templates, make sure they are really up to date. You've got we've seen practices use out-of-date templates. They haven't got the current coding in for QOF rules. Be careful with time-sensitive indicators such as echoes. So with echoes, you can, if you've still got patients who are missing that echo, I would highly recommend going back to that indicator, which is HF 003. You can get around it by adding the refer to echo in the right time date. So we've just done an exercise for a practice. It was all there. It was just how the data was entered onto the system. And because of the QOF rule sets, it meant they had 45 that didn't meet that indicator. But if you press the refer to echo, add the correct date in, that will date that in the right time period that the echo was received. Do understand the exception reporting as well. You know, some of these take patients off the register, off the indicator, others don't. And completing reviews, like we've seen, there's many practices who are doing the reviews, but patients aren't on the register. So just make sure your clinical teams who are running the clinics are checking when they even come in that they are on the register. There may be an asthma patient, but they may not be featuring. So all the work that you've done so far may not be, you know, ticking those boxes for QOF. It's an easy thing to do, but also something that you can correct as well. So just some final takeaways before we go back to Q&A and Claire. So make sure, whether it's the Oberoi QOF tool, your population manager, some people are using Ardens as well. They said they're using that. They find to do they've got the QOF manager, find it quite clunky to use. So again, if you are, make sure you're using it to its maximum ability. It's really important at this time of year that you have something as well as population manager that helps you be a bit more strategic about QOF delivery. Understand prevalence and undertaking. This is never finished. You know, this is something that you look at the beginning of the year, middle of the year, and the end of the year. It's amazing how it can change. And especially when you've got teams sometimes as well who've left. So as I said, we've got a practice where we've now taken their register up to 400 for heart failure. It was at 200, and they've only lost their heart failure specialist nurse 5 months ago. And also think about the tools for data collection and recall, such as AccuRx. You know, how can you integrate more digital tools into that journey? Okay, so I'm going to hand back to Claire. If there's any questions, again, please pop them into the chat.
Thank you very much, Kavita. That's really interesting, and I do like the calculator. I'm just going to share with you now our digital and transformation hub, as this is part of the offer that we'll be explaining to you later. So if you haven't seen our hub already, it is a short assessment set for many areas, including communications, access, patient journeys, workflows and efficiencies, workforce and leadership, and demand and capacity. And for each of these topics, you'll then be able to do a short assessment. So if we use population health management here, you can see at the top, let me just go back. Once you've completed the first assessment, which is a simple statement as to where you think your practice sits for each of these, you'll get a colour which suggests if you're foundation, developing or advanced in that area. Now this is my test site, so obviously I'm really awful at most things in my practice, but if we can pick on population health management, you can see that you can go in and start this assessment, and it's a really simple frowny face to a smiley face as to where you think you sit for each of these. So if I just quickly fill this in, I am and finish the assessment, you will see that I've had 8 actions added to my action plan. So if I click on my action plan, I can then go and see that 5 of them sit underneath population health management, and this gives you a real action plan to go from. So adopt advanced data analysis tools and techniques, which if you have the Oberoi tool and others, you will be able to press complete. You can write some reflection comments, a review date, and you can pick what you think this has had an impact on in your practice. So these all relate to modern general practice access, capacity and access, and then we will complete the action. And you can see here I've moved from developing to that middle section there on that, just from answering those questions. It's really useful to know where you sit, to get a little bit of guidance as to where you might want to make improvements. Our knowledge base is full of information on how to make those improvements. So it gives you resources and guidance as to how to use these tools and techniques. And it also includes our Edge dashboard, which has many, many different things that are freely available for the NHS, such as online consultations, NHS app, and we've just added telephony because that came out at the end of November. So you can have a look through there and see where you sit. You can filter that by region, ICB, sub-ICB, PCN, or GP name. So you can have a look there just to see how you're getting on with them things. So I will stop sharing that now. I hope that's a short enough, quick enough overview for everybody. And And I will just share the PowerPoint slide again. So just coming back to QOF, I know that we've focused a lot on QOF, and Kavita's mentioned it in her slides, to think about it strategically, to think about what's going to be your highest wins, what's going to be your quickest wins. And there's many areas that will touch on QOF that also touch on other things in the GP contract, in IIF, and network DES. So just to get you to think about what you can do in your QOF that will impact something else as well. So if you work smarter, you can get those ticked off for both contracts. And we're now going to move on to Q&A. So I am going to open up microphones and cameras for everybody. If you have a question, please either pop something in the chat or put your hand up. I see Kavita's popped in there. That's the trial version of the Oberoi QOF calculator, so that's really useful. That's really, really good to let you get a feel of the tool itself. Yes, Paul, we will be sharing the slides. We'll share them through the D&T Network, so you'll be able to access them from there, and the recording from today.
Regarding the trial version, what you can do, you can go in, you can download the searches, you can upload your data, and you'll get a sneak peek at some of those high value indicators, some of the validation work as well. And if you like it, you can upgrade to the full version. So if nothing else, have a little play. So I'll put the link into the Teams.
Fabulous. And you may have some questions on this, so hopefully we've been able to help you today to understand the Oberoi QOF calculator and a little bit more about what's more important in QOF to look at in these last 4 months. We have got a joint offer together, so if you'd like to take up our D&T Hub core support offer, which includes the hub and the dashboard and support from the Redmoor team, so you'll get a monthly meeting with one of us to guide you through your next steps for whatever you want to cover in digital and transformation. And you'll also get the QOF calculator, and you'll save £75 if you get in touch with us if that's something that you're interested in today. The email address is on there, but I will pop it into the chat as well.
I'm also going to put my address into here as well, if anybody's got any further queries or would like a 10-minute demo of the QOF calculator, maybe with partners or the recall team. We have also been working with some PCNs where we've also developed for them bespokely the bit on the PCN DES. So they've added that, they've done a little bit of an upgrade and added that for their PCN DES because they bought the calculator for the whole PCN. But it would be great to have some feedback in the chat. Thumbs up, did you enjoy that? Hopefully, you know, what was your key takeaway maybe? So I think there's quite a few of you on, so if you want to sort of pop that in the chat, because often, you know, we learn from each other. And if there's something that you're doing that wasn't mentioned in the presentation, that would be really good to put in the chat as well. So fire away and we'll try and share some of those key learnings, or maybe something that you're doing currently in your local practices. That would be really good. I can see we've actually got some of you joining the trial version.
Amazing. That's brilliant. Okay, so we have also got a feedback form for today's session. As Kavita says, if you don't want to pop anything in the chat, that's absolutely fine, but we really do appreciate your feedback. It does help us build these sessions every time we learn something new. And the bonus is that if you fill this in, you go into a monthly draw and you might win a £25 Amazon gift voucher. So it's worth a few minutes of your time just to let us know your thoughts, and if there's anything else that you would like to see in these webinars. But yeah, if there's no further questions, thank you very much for joining us today. I hope you found the session useful, and we will be putting all of this information onto the D&T Network, which you'll be invited to after this. We're also on there if you want to ask any questions, and you've got Kavita's email address and our support email if there are any further inquiries. But thank you very much for joining, and I hope you have a lovely rest of the day.